Hey guys, Dr. Matt here. Want to talk to you guys a little bit about stretching one's stomach after surgery, how it happens, why it happens, ways to avoid it, as well as touch a little bit on the hunger you'll feel after surgery and whether that's hunger derived from the stomach itself anymore or hunger up here, all right? So first and foremost, when we're done, you'll have roughly a 6-ounce stomach. If you're a taller individual, you'll have roughly an 8-ounce stomach, okay? With time, and by with time I mean 6 months, maybe a year, there's some natural relaxation that occurs in everybody. So if you have a 6-ounce vessel to begin with, it'll naturally settle to about 8 ounces when we're done. And if you have an 8-ounce stomach to begin with, it'll naturally settle to about 10 ounces when we're done. That's completely expected, that's completely normal, no way to avoid that, okay? A couple extra ounces isn't gonna be the end of the world when it comes to putting weight on. It's not gonna happen, all right? But if you're constantly pushing the limits of what the sleeve can comfortably hold, with time, you won't have the pain, you won't have the nausea, things won't come back up, and that extra bites that you're pushing in there will stay in. If you're always pushing the boundaries and taking that extra bite, with time, your sleeve will adapt and comfortably hold that extra bite. Then guess what? You can fit another extra bite in there. So if it takes 6 bites to make you feel full at first, and then a year out, you're always taking that 7th bite, with time, you'll hold all 7 comfortably, and then you can fit an 8th bite in there. And if you're always pushing 8 in there, the sleeve will stretch, adapt, and comfortably hold 8, then you can fit 9 in there. So it is possible to stretch the sleeve, but it takes a concerted effort to overeat and constantly test the limits of the sleeve. So my recommendation is you have about 6 months to a year during which time to figure out how much you can comfortably eat. Once you have that idea in mind, stick with that indefinitely. If you're the kind of person who pushes the boundaries, weigh your food out. You have a 6-ounce stomach, eat 6 ounces, and even if you have the urge or the drive to eat 1 extra bite, you won't do so if you're weighing your food out and being a little scientific about it, okay? Now, when it comes to hunger after surgery, there's a difference between the natural evolutionary drive to eat derived from the stomach's communication with the brain versus your brain tricking you into feeling that you're hungry even though your stomach's not telling you you're hungry. I remove with the gastric sleeve the drive to eat, but if every day you drive past a certain place and your brain stimulates you to feel hungry, different story. I can't solve the hunger drive here. The hunger drive here is what we take care of. This part is troublesome in some patients more than others, but you gotta realize the natural evolutionary drive to eat is removed with the surgery. You have to figure out what you can do from a psychological and social aspect to deal with the head hunger that you might feel. But remember, the natural hunger drive is removed with the surgery. You have to fight the demons in the head that might drive you to eat as a result of head hunger. If there's any other questions, shoot us a text, give us an email, we'll figure it out and we'll answer it as we can.